NIHR Starfleet Command message. Red alert. Repeat, red alert. Earth in trouble.
Good evening. The coronavirus is the biggest threat this country has faced for decades, and this country is not alone. All over the world, we're seeing the devastating impact of this invisible killer. And so tonight, I want to update you on the latest steps we're taking to fight the disease and what you can do to help. That is why people will only be allowed to leave their home for the following very limited purposes. Shopping for basic necessities as infrequently as possible. One form of exercise a day, for example, a run, walk or cycle, alone or with members of your household. Any medical need to provide care or to help a vulnerable person, and travelling to and from work, but only where this is absolutely necessary and cannot be done from home. That's all. These are the only reasons you should leave your home.
Enterprisingly, Central PHIRST, National Institute of Health Research, Public Health Interventions Responsive Studies Team, our 3-year mission to evaluate public health interventions using logic modelling and other innovative techniques, seek out new ways of working during COVID pandemic and beyond to boldly go where no research team has gone before.
NIHR Starfleet Command message. Prime Directive, Mission 1. To evaluate the drug and alcohol services on Earth in the city of Leeds. Examine how they worked pre-COVID, during COVID. Discover the best way to move forward in this ever-changing universe. The stakeholders, commissioners, and NIHR seek evidence.
It will be rapidly responsive. The clue is in the title. We are still in COVID restrictions. There will be many challenges. Viral shields must be raised. Phasers set to stun. We come in peace. There will be no casualties. In this intergalactic COVID war, researchers will win, armed with adaptable thinking, logic, and the service user voice.
Enterprise grounded, beam down a landing team to planet Earth. You will all work from home. We'll need out-of-the-box thinking. I know we are trapped in these boxes for now. Families and pets all present, dividing our attention. The trouble with our cute tribbles evident, causing Zoom bombing and unexpected amusement. All will be done from our wide geographically spread Earth home locations.
How will we remotely capture the service user's perspective? We need critical friends, some with lived experience. No, we are asking the right questions, nothing appropriate. Public involvement is translating the messages into plain, inviting, non-alien language. Alien recruitment and results will reflect what service users need.
We shall make it possible to consult with service users from Leeds, co-produced with Central PHIRST Public Involvement in Research Group, PIRG. IT skills may be few, admin support vital, antiquarian hardware struggling to keep up with the modern software demands.
You are not authorized to access this facility.
No camera. Anonymous disembodied voice. Okay. Or mobile phone connection. We don't mind. People freeze. On screen. Mid-idea. Connection lost. Abandoned in deep virtual space. Support workers and supportive research team. Collaboration vital. To facilitate the service user voice in the research design. All working to a flexible roadmap with the same ultimate destination.
The powerful service user voice will not be lost in space or abandoned due to challenges. Included in all research stages, training given is needed. Valuing realistic perspectives, payment for time given. Feedback constant, effects monitored, reflections gathered, learning shared.
How do we engage with those who wouldn't normally take part in research? The underserved communities whose perspectives are vital. Those with technology deprivation who do not fit in this futuristic virtual world. Text messages have been used before. We could do that. Send out simple questions by text and they respond by text. All they need is a mobile phone.
Some may not even do that. The sex workers will not. Innovation required support workers to ask the questions, bringing back the answers. Creative writing workshop producing anonymous client narratives. All voices are heard and valued, inclusive methodologies created.
Captain's Log, start date 18th to the 6th, 2021. Our mission achieved long-distance collaborations, forged creating the dream team of service users and researchers. The intergalactic standards for public involvement in research have been met. We have survived the pandemic and gained new knowledge, new experiences along the way. We have superior strength to fight should the Klingons attack with more germ warfare. We can all live long and prosper.
Well, hello everyone. Thank you for coming to our presentation and watching our video. We know it's sometimes difficult to make sense of things that you see, so we're gonna have now some time to explain what we mean with the video and lay out some of the more practical elements of involving the public and hearing unheard voices during the pandemic. I'm gonna share my screen. My name is Jamie Garcia. I'm the research fellow at the PHIRST Central Team, and this is my colleague Amanda Wellings and her cat, Rover, who are the PPI co-applicants in the team. Our presentation is titled Powerful is a Service User Voice, and we aim to explore how service user involvement can take place during a health crisis, some of the complications, but also the benefits of this approach. When we started this project in March 2020, we were faced by a red alert. We had to work from home, we had to combine our work with childcare and homeschooling, and there were additional work pressures and stress that everybody felt across the country. At the same time as that was happening, we were funded by the NIHR to conduct one of 4 PHIRST teams. These stand for Public Health Intervention Rapid Studies Team. Our first project as part of that partnership was to evaluate the drug and alcohol services in the city of Leeds in the north of England during and after COVID-19 through 3 community partners. Our working group is composed of 4 universities, led by the University of Hertfordshire, but with collaborations by the University of Birmingham, East Anglia and Ulster. Our goal was to research public health interventions as they fly by, that is, as they are happening, and be able to provide rapid evidence-based advice to community partners on how to improve their services. At the same time, we have to do this during a pandemic while surviving a pandemic ourselves, and this required much out-of-the-box thinking. In order to provide out-of-the-box thinking that was also reliable, evidence-based, and considered the experiences and the needs of our public population and our service users, we needed to involve public members in producing the research at all stages and obtain a representative participant sample that would allow us to draw conclusions that could enlighten policy development.
Patient and public involvement in this study involved the Patient and Public Involvement PERG group, which stands for People in Research Group. We set up a specific People in Research Group for this first. So There already was a People in Research group in Hertfordshire, which was established in 2005. And that was led by Professor Julia Jones. And she remains with me on this as a member of the research team and an applicant. So me and Julia Jones worked together to put the patient and public involvement into this study. We have a separate patient involvement in research group, which has got about 10 members. And that's called the PHIRST Central Patient Involvement in Research Group. Some of the challenges that we've had is working remotely in digital inclusion, because some of the people that we worked with had no idea how to do Zoom and team meetings and things like that. And we've had to involve the IT people in Hertfordshire, which also provides problems because not all of us are based in Hertfordshire. So it's been a lot of sort of online being talked through things and other ways of getting around how we actually manage to work remotely with service users and PERG members. Yeah, there's been quite hefty workloads. I think sometimes I didn't realise how much I'd end up doing on this project, and the amount that was timed in for the project just doesn't give me enough time to do a lot of the work that we're having to do it going remote. So that sort of is the same as the costs really, but we have saved money. We've managed to save money by not having to travel to meetings and things like that. So we do actually have some money to pay for the extra time that's needed, which is good. Yeah, solutions, yes, we have managed to equip everyone with IT, even though it does go down sometimes. So we end up having to do people phoning into Zoom meetings and things like that. Yeah, flexibility, we're all having to be flexible. That's what's coming out of COVID, just having to change things and be willing to look at the bigger picture. We've got really, really good admin support, which is good. And we feed back everything that's done in our PPI work. And we use the Maffei et al. Feedback study as a background for this. Yeah, everything's planned in advance. We have wonderful support. And we always have to be mindful of how much we're asking people to do and make sure that we give people as much notice as possible when work's going to come in for them to do. And remember that a lot of the people that we're working with have long-term conditions or are caring for people.
Fantastic. So we also wanted to involve participants with lived experience of drug and alcohol services in the city and their evaluation. Anecdotal evidence suggested that different groups who were accessing those services had different impacts. For some, the isolation, housing, and changes to their work and life patterns had been very positive and had helped them attain their goals in recovery, whereas others had struggled a lot during the lockdown and post-COVID times. However, in order to involve these many participants, we also had to be mindful of the restrictions that were in place at each month or almost every week, as well as the procedures in place both at the university level and with our partner organizations. So we had to face a paradox. How do we use digital methods to engage with those for whom digital methods don't work? Those people who didn't thrive in all online service provision environment were the ones that we were interested in reaching, but we had to reach them through those very digital methods. So we had to come up with alternatives and meet them where they are. One example of that is the development of text-based conversations, which have been used previously in sociological research, by which we ask short questions to participants over text message. This avoids them having to have data on their smartphone It avoids having to have a conversation over the phone, which with some of them are not really comfortable. And it also avoids having to have a laptop or a smartphone or tablet to have Zoom. And we've found this to be very useful to get quick information about participants' experiences of drug and alcohol during the pandemic. In general, is it worth it? Is it worth it going to all this length to involve the public and participants in the production of research? Yes, but there are some caveats to this. The first is that you require expertise and capacity to do this. You have to follow, or you may be guided by the NIHR standards for public involvement. You also may need to consult with experts in the field of public involvement. You need the capacity to manage all these admin and IT issues and cost issues that Amanda so well explained. You also need flexibility. The pace at which academics work, the tight deadlines, the rapid turnaround may not always work for public involvement or for participants. And at the same time, ideas that may sound really well or really good in paper may not always work for people on the street. However, involving the public and participants does help to identify the right questions and eliminate those that may be deemed inappropriate or daft by potential participants, and involving them in the co-production of the design and the analysis really expands the capacity of the research team to understand the findings and the conclusions. These are some of our references for this paper, and here you can find a transcript for the video. We tried to use subtitling, but we didn't manage to do that, but here's the transcript for the video. Thank you very much, and hope to see you on Friday.
Thank you.